take you to the story. The NICD has launched a new dashboard to enable the public to access the wastewater surveillance report. The presence of coronavirus genetic material in wastewater is an early indicator of outbreaks. To tell us more, I'm joined by Jay Bhagwan from the Water Research Commission. Thank you very much, Mr. Bhagwan, for your time here on all angles. I'm interested to know practically, as a community member, how do I look into wastewater sewage to find out if there's a breakout in my particular area? How does that work?
In our endeavor to get access to information and knowledge to the broader community and society, this is quite a milestone in our efforts that we've established this a new platform that acts as a bidirectional communication that will, go far in empowering society in contributing to managing, this virus. So the dashboard has several layers where we'll be able to, using the GIS platforms, link the sewer sheds or the areas that the wastewater treatment covers in your city. And for each of those wastewater treatment plants, we are monitoring the presence of the remnant RNAs of the COVID virus. And the number of copies at that wastewater treatment plant gives you an indication of the level or the burden of disease within your catchment area, as a community. So that's quite powerful because the movements in the number of RNA copies, gives an indication on that level of burden. And what's more great about the wastewater surveillance element is that it picks up, people in that area that are symptomatic and asymptomatic, but, have, the infection within them. So those remnant particles gives a better indication on the burden in that area and in that community.
You speak of RNA, etc. I just need you to help me understand in layman's terms exactly how this would work practically, and if we were correct in saying that an individual might be able to actually track this themselves.
Yeah, so, in our discipline, we say our poop does not tell lies. So, many things that we ingest ends up in our gut, and then, it's excreted in the human waste. Okay. So all we are doing is we are looking for that specific protein signal in human waste. And the potential for this platform that we've created opens up the pathway and the possibility for doing many, many other health-related screening and surveillance into the future. So things like obesity, things of abuse of substances, etc. It opens up all those opportunities. So that's why I say it's a milestone, because it opens this new pathway and a new opportunity to, using surveillance as a mechanism to manage the health of the population going into the future. But at the moment, the presence is, the COVID virus, and anyone that's infected would excrete the remnant protein particle, which is non-infectious. And I need to make this very clear. These protein particles are non-infectious. There are no live viruses. So we are able to look for it in the human waste, and we are able to then give an indication of the level of activity within that community.
In terms of you having this surveillance done, how far and wide was it in the country? Was it only in certain provinces, or how far did you go?
So, this program covers between the NICD and also I need to give recognition to the MRC, roughly close to about 150 odd wastewater treatment plants. But we use the word sentinel, so we, over the time, we cover all the hotspot areas, in completion. So all the metros, for example, have all the wastewater treatment plant covered. The areas that we've picked up as hotspots in the previous waves, we capture them, completely. And then we have other areas around the country that we look as an indicator to see if there's any movement specifically around rural areas, rural towns, etc., where we haven't seen the big surges, etc. So I think, from a strategy perspective within the resources, we have about 70% of the country, well captured through this platform.
I want to go back to your first point where you said that with this wastewater treatment and the surveillance of it, you're able to even tell positive cases from those who are even asymptomatic. So when we get, the statistics every 24 hours from the health department, they're obviously giving us statistics in terms of people who went and tested, either because they were exposed or they feel sick, right? So with these numbers, the resurgence of these numbers, it looks quite high at the moment. Would you say it's a true reflection, or does your surveillance show something worse?
So at the moment, the wastewater samples, we're not able to give a good estimation or enumeration based on the number of copies we're seeing in the wastewater to sort of predict the number of people that would be infected. We are still doing the science around how we relate this relationship between the number of copies to possible number of people infected. So we use the overlay of the clinical data is a more realistic, picture, but, we know that, from experience that it's possible that there's 20% of the population that have very mild symptoms and they don't end up, going into clinical testing and those kind of things. So there's still a potential spreader of this virus without knowing that, they have the symptoms.
Just very quickly, a yes or no, are we in the fifth wave?
Well, we've indicated about 2 weeks ago, based on the number of copies, we were concerned on the large jump that we started to see consistently over the 3 or 4 weeks. And I think the clinical cases are beginning to show that we are in that trajectory. So it's a good possibility that we are heading in that direction.
All right. Well, thank you very much, Mr. Bhagwan, for your time here on All Angles. That was Jay Bhagwan from the Water Research Commission speaking to us about this new wastewater dashboard launched by the NICD.